Hi, I am Dr. Kate Utek with New Journey Physical Therapy. I work on the North Shore of Chicago, and I help people who are pregnant or postpartum or with pelvic floor dysfunctions to live life without restrictions. So today I want to do a video for you about measuring your rectus diastasis. So a rectus diastasis is the abdominal separation that naturally occurs during pregnancy. 100% of women have this during pregnancy. But that doesn't mean it needs to make you feel weak or that you need to be unable to lift and care for your children or to exercise after pregnancy. It should heal to the point that you can feel strong and capable. So if you are feeling weak, it's a good idea to just get an assessment, figure out what's going on, whether this separation might be a portion of what's going on for you. What we really care about is how your muscles respond functionally. That means when you are lifting your kids, carrying them, if you feel great and you have some abdominal separation, then that's probably not really affecting you. You're in life, your muscles are working together in the way that we want them to. But if you're feeling really weak, then doing this check then might give you a sense of, hey, maybe this is part of it and I should go see a physical therapist who is trained in treating pregnancy and postpartum, not just an orthopedic physical therapist that you might find anywhere. Go see someone trained and who specializes in this. So we're going to roll on our side and roll onto our back. In this position, keeping your knees bent, you're going to lift up your shirt so that you can see your abdomen. At the belly button, you're going to put your fingers. You can start them, I usually start them vertically like this in line with my body, and lift your head. What you're looking for is to feel if there is a space between your muscles. If you have a wide space, you can turn your hand the other way across your body and see how many fingers slide in. And then come down. I usually then say, for self-checking, you want to go halfway between your belly button and your rib cage. Place your hand and lift up again and see whether there's any separation there. And then, as the third location, halfway between your pubic bone and your belly button, and lift up. And that's going to give you a sense of what is the current state of your entire abdominal wall. Roll onto your side and come back up. What you're feeling for is that separation between the muscles, whether your hands can slide into a slot, and then how deep they go. If they slide in, but it is firm, tight, then your muscles really are engaging the way that we want, and you're able to use them. And that's probably, you're less likely to have significant symptoms, and this is less likely to be a significant issue, even if there's a wider gap. But if there is sinking, if you really feel like you can sink into your belly, then it's more likely, if it's both sinking and wide, then you might be experiencing a lot of weakness. So any width, any sinking, or a combination of both will give us a sense of whether this is a factor for you in what you're experiencing in your life. Thank you very much, and hope this was helpful.